Kalgoorlie Health Campus is one of the larger remote hospitals in Western Australia, one of the larger regional hospitals in Western Australia with over 100 inpatient beds. And our number and acuity of presentations at our emergency department really reflects that. We have an area where we're surrounded by mining industry, we've got pastoralism, lots of different industries around us, lots of communities and remote communities, and we service right out to the Northern Territory border, South Australian border, and right across the region.
Kalgoorlie Hospital ED is a very busy ED, which sees about 28,000 patients per year, and based on the equity of patients, because we do have a large population of patients with comorbidities and about a 12.5% population of Aboriginal patients. So it's a challenging ED, but equally it's a very exciting place to work because you can see a varied number of presentations and you can make a big impact to these patients who are presenting with emergency problems.
There's some really exciting up-and-coming initiatives for the emergency department here in Kalgoorlie. We really value curiosity in Country WA, in our health service here, and we're always looking for opportunities to see that thrive and develop. WA Country Health Service have always been one of the world leaders for telehealth at Kalgoorlie Health Campus. We're now looking to partnership with the East Metro Health Service and take that to the next level with the health in the virtual environment, or the Hive model. This will see our high dependency unit beds hooked up, linked in with the service in Perth, who are able to use artificial intelligence as well as other methods to monitor our patients and make sure that they're linking with the best care that can be provided, not only locally at the bedside, but also with that support from a tertiary facility as well.
I love working in Kalgoorlie for the variety of cases that I see. And I love the teamwork that we have in Kalgoorlie. We are such a small hospital, but we all work together. It's more like family than anything else. From our nurses to our PCA to everybody, we really interact well, and I think that's the big point for us. A typical day in the emergency is hard to say what it's like. We get lots of age groups, from a newborn to a 90-year-old lady that can come from the nursing home after having a fall. We have a big Indigenous population. At the end of the day, I feel good that I've really tried to help these people.
There has been an enormous amount of effort in Western Australia to develop a system of support which is based at the command centre in the city. It's utilised when you're dealing with mental health emergencies, because there's a specific team that deals with that. With emergency physicians, with toxicologists, there's an opportunity to involve trauma surgeons. And what it means is that you simultaneously are getting a level of support, but also a level of involvement and cooperation, because people in Perth know what's going on in Kalgoorlie. But if you've got a renal emergency, you can actually engage a renal physician to chat with you and actually see their face in the room. It's extraordinary, and for the people who work in the bush, it gives you a feeling that you're never very far away from somebody who's actually there, interested in you and ready to support you.
Opportunities in Kalgoorlie is great. It's a good community. We have about 30,000 population. We have so many good schools. Especially if you have a young family, it's an excellent place to bring up your kids. We came when my son was 8 years old. He grew up here, now he's in med school.
Working in the rural environment's given opportunities I would never have imagined when I started as a clinician in a tertiary facility. Coming out here at first, I was quite anxious about what kind of clinical support, mentorship and opportunities I'd had. And really, I should never have had any of those concerns. There's a huge expanse of schools, from childcare centres and preschool environment right up through and into high schools as well, private and public. And the best thing is that when you're working here at the hospital, you only have a few minutes from these facilities. So I think that Kalgoorlie offers a livability that you don't get anywhere else. Having said that, Perth's right on your doorstep. It's a really quick 1-hour flight or a drive that we're all familiar with.
We have time for each other, I think. We know our neighbours and people really look out for each other, and it's a great community. So come and have a look and see what Kalgoorlie has to offer.